Hi and welcome to this posture routine. This is a slightly longer posture routine. It's going to be about 45 minutes. We are working on both upper body and lower body, but specifically we're going to work on your pelvis, hips, and some feet and footwork stuff, as well as the trunk. The trunk is basically everything between your pelvic bones and your collarbones. So it'll be a bit of core work, but mostly I want to work in flexion for this particular routine. So really encouraging a sort of less sway back, less rib flare, and really encouraging people to sort of feel like they have more capacity in the flexion aspects of both the pelvis and the spine. You're going to need a strap, cushion, your foam pad, a set of blocks, and a low stool, chair, or plyo box. Now, what I mean by low is normally I would say the chair, stool, or plyo box you use is about your knee height. You can see this one is about the sort of halfway point between my knee and my ankle, okay? Because again, I want to work on deep flexion to start with. Okay, so first exercise, you are going to need to sit on your low stool, chair, plyo box, whatever you're using. And you're going to start with a cushion. You're going to keep your feet hip distance apart. Actually, as a good practice, let's start with a balance test. Sorry. So we're going to come into a balance test. Just kicking out the feet, kicking out the hands. And coming to stand nice and easy without biasing your feet. Keep your eyes closed, belly relaxed. Dropping the arms just by your sides. You're just going to take a few big breaths here. Exhaling through the nose. And again, big breath in. And big breath out. And then just take your attention down towards your feet. What we're doing here is we're just taking inventory of where your balance is between the right foot and the left. For some of you, it could be one side, one heel, opposite toes. It could be to the insides of your feet, outsides of the feet. I feel like it's a bit more in the right heel and the inner left foot for me today. So that kind of gives me some kind of awareness that I'm like twisted in my pelvis. Possibly even laterally shifting into my right side. And then as I work up towards my hips, they do feel very tight, just because I've been sitting a lot last few days. And then traveling up towards my rib cage. Shoulders feel quite rounded, but my right shoulder and the right side of my upper body feels like it's rotated forwards today more than my left. Neck overall feels good. But I can feel like my head's sort of tilted a little bit to the left side. So I'm just taking inventory of where my body's at. And let's just take a few nice big breaths before we start in our posture routine, keeping the eyes closed. You're going to just bring both your hands just onto your midriff, your belly. And you're going to really try and emphasize the in-breath by inflating the belly, expanding the diaphragm. So really try and prevent the breath coming through the throat and into the chest first. You really want to feel like it's coming in towards your belly. Long, big breath in through the nose. Filling the air capacity in the back of the rib cage. Exhaling gently through the nose. Once again, big breath in. Exhaling through the nose, through the mouth. Good. And again, big breath in. Good. And then from here, we're going to come and sit on our low chair or stool. I'm just using a hip thrust plyo box here. So from here, what you're going to do is you're going to bring your feet directly underneath your knees. For some of you, you might feel like you've got your feet underneath your knees, but they're actually behind the knee line. So just take a quick peek over to the sides, really making sure the lower ankle bone is right above the knee. You're going to grab a thin cushion, place it right between your knees. Now this part takes a little bit of practice. You got to keep the balls of the feet, pinky toes, heels grounded into the floor without lifting the heels. So really find your 3-point contact of the feet down in the ground. And this is the part that needs practice. When I say relax the spine, many of you are going to be sort of inclined just to sort of round the shoulders. But actually what I'm encouraging you to do and think about is, how can I just relax into like my mid spine? So you can see here that I didn't round the shoulders, I didn't drop my neck. I'm really just allowing my spine to be soft so that I can feel the weight in both my sit bones really nice and easy, but also more heavy. And you can see here that my gaze is still neutral. I'm not having to sort of look down, because if I'm going to use my shoulders more, that's going to really encourage my head to pull down too. Okay, so really just feeling like you're relaxed in the spine, almost feel like you're just chilling watching TV. And then before we begin, all I'm going to get you to do is take 3 big breaths, and I want you to feel like you're blowing air into your shoulder blades. Okay, so you're really going to feel like you're expanding this mid back. And then exhale. And I know many of us are averse to like thinking about a relaxed spine, rounded shoulders, but I'm not asking you to live in this position. I'm really just encouraging many of us to get into this position, because so many of us live somewhere like here. We're too swayed forwards, our chest and our rib and our pelvis is so much in extension. Long, big breath in through the back of the ribs. Exhaling. Long, big breath in one more time. Good, and exhale. Good. Now what I want you to do is I'm going to ask you to squeeze the cushion and hold about 60-70% squeeze. And then I want you to really try and relax your inner thighs. So you're just squeezing with the knees, but trying to relax the area just around your pubic area, the groin, and that area. Good. And then what I want you to do is you're going to turn your body over towards the left. You're going to reach your right hand and just hang it over towards the outside of your left leg. You're going to tuck your chin here very slightly. And then I want you to take 3 more breaths here. So a gentle hold of the cushion. So this should kind of help you feel like it's releasing the side of the right of the neck and down into the right side of the rib cage, all the way down that pelvic side. Big breath in. Big breath out. Good. Big breath in. You can see my hands are just chilling. Good. Exhale. And then over to the other side. Right arm's going to hang, left arm's just going to reach over towards the right side. Try not to let the knees kind of drop over to the left. Keep the knees right above the ankles. You're going to drop your chin and you're going to reach those arms down towards the floor. Really feel like you can release the neck. And then gentle squeeze of the cushion, and let's take 3 big breaths here. Again, big breath in. Big breath out. One more time, big breath in. And big breath out. Good. And then we're going to come back into center. Repeat that sort of relaxed spine effect. Hands are just going to dangle. And then we're going to go for 3 sets of 20 knee pillow squeezes here. Keeping the ground, feet connected to the ground. This is 2, 3. And I want you to feel like you can relax your lower back, relax the inner thighs. Just use the knees. I can feel something really releasing in my lower back, so if that's happening for you, enjoy it. Good. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, good, and 20. And then from here, you're just going to crouch over, maybe bring your chest just on top of that cushion, or just lower the cushion so you can bring your chest down. I'm just going to move my mic a little bit over to the side. And I want you to just rest your head on top of that cushion. Arms are completely relaxed. So your head has got a little bit of support there, but it's completely relaxed in the neck. And I want you to breathe 3 times here into the back of your rib cage, back of the body. Gentle squeeze of that cushion, nothing too vigorous. Again, big breath in. And big breath out. One more time, big breath in. Good, big breath out. Good, come up into seated. Again, flex your spine. Bring the cushion back up. We're going to go for our second set of 20 knee pillow squeezes. I can feel something releasing in my neck, lower back, left arm also. So whatever's happening for you, just let it happen. 2, 3, 4. Even in relaxing the spine, try not to tilt the body weight forwards. Keep the center of the head right above your pubic area or the center of both your butt cheeks. 4, 5. A good squeeze and a good release. So when I release the cushion, you can see here my legs are already starting to respond. So I basically should be able to walk past you and with 2 fingers just take the cushion out from between the knees if you are releasing completely. Good. 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, good, 17, 18, 19, and 20, and good. Again, just going to press that cushion down, bring your forehead down. This time, you're going to splay the toes, keep the balls of the feet on the ground. As you take those 3 breaths, you're just going to bring the heels off the ground about 2 or 3 inches. So you're not completely raising the heels, about say 3/4 of the way up. Let the pressure of the cushion meet the forehead slightly. Mouth is relaxed. Cushion is released about only kind of a hold of about 5% more than what you had it when you relaxed earlier. And let's breathe into the back of the ribs here. As big a breaths as you can possibly take. Big breath in. No grabbing of the toes. Exhaling. One more time, big breath in. And exhale. Amazing. Release. Last set of 20 knee pillow squeezes here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 1, 2, 3, 4, 5, 16, 17, 18, 19, and 20. And I want you now to just hold the squeeze for as hard as you can. Keep the belly relaxed, inner thighs relaxed. We're going to hold this squeeze for 1 minute. Long, big breaths. You can see here my upper body's having a nice reaction. Just keep holding the squeeze. The more you relax, the more capacity you give your body to respond. So just breathe. Hands are really, really loose. Spine is flexed. Just let the squeeze of the cushion help other parts of the body start to connect. Last 30 seconds, keep squeezing. 5, 4, 3, 2, 1, release. Good. And then what I want you to do is you're going to bring two blocks just to the sides of your thighs next to the your chair or your stool, your plyo box. Now, if you're using a single stool, then this isn't going to be possible. Like I've got a long bench here. So what you could do is just move over to a couch and you could, or a hard sort of sofa, and you could do this on there. All you're going to do is you're going to switch the cushion for a strap, bring it around the thighs. Hip distance, not wider than hip distance, so a little bit more snug than you think you need to have them. And again, I want you to round the spine, and I want you to just use the height of the blocks to lift your shoulders up towards your ears, but keep your elbows bent. So you're not pushing the arms, you're not gonna lock them out. You're just gonna bend the elbows, they're just gonna be on a height. You're gonna pull that strap. You can already see something's happening in my shoulders, and I want you just to relax your elbows. The fingers are wide, palms are flat on the cushion. There isn't really a push of the hands into the cushion. It's literally the height that's gonna help us release traps, bring our rib cage into a little bit more flexion as we bring the pelvis also into flexion, okay? So feet are grounded. You're gonna pull that strap just by using the knees, so everything in the pelvic, pubic area stays relaxed, abdominals relaxed. Bring both your palms, fingers facing forwards on top of these blocks. Elbows are not gonna turn outwards, they're gonna just be in towards the ribs. As you pull the strap, I just want you to shrug the shoulders up towards your ears, but keep your elbows bent. So watch this. I've got elbows in towards my ribs, as if they're being clipped behind me. And then I'm just gonna elevate my shoulders up to the ceiling. And I'm just gonna hold this, look down towards the floor, keep pulling the strap, relax my head, and I'm just gonna breathe. Yep. You can see here something's happening in my rib cage. You can see something happening in my shoulders. Long, big breaths. You're just going to relax. We're gonna hold this for 6 to 7 minutes here. So you're just gonna breathe and hold. And remember, if you have an issue with the setup, if you feel like your reaction isn't quite what you wanted out of the exercise or what I'm getting out of the exercise, you can always do a video audit and put it into the community chat box so that I can view it and help you with your setup. Just let me go through that again. So your elbows are pulled back, rounded, you're still rounded in the spine, your gaze is towards the strap or to the floor, but you're going to lift the shoulders up towards your ears. So like, imagine you were just kind of saying, I don't know, your shoulders are up to the ears, palms are on the blocks facing forwards, elbows are pulled back, and your spine is rounded. That's all you're doing. And there you have it. Like literally my body's already reacting because it's intentional. I'm literally trying to put my pelvis in flexion using the strap, but also the height of the chair or the box. I've got my ribs and my trunk in flexion, and this is helping me reposition how my pelvis, my shoulders, my arms, my rib cage relate to one another, because I'm removing the compensations that many of us have in either a sway back, a rib flare, and really poor sort of positioning of the feet and the tibia in relation to the pelvis. So it's such a great little exercise. It literally looks like I'm doing nothing, but there's lots happening here. So just keep breathing, release your head. And really feel like you can breathe into the back of the ribs. I'm holding so much tension in my neck, I can feel it, so I'm just going to release. We've got 1.5 minutes to go. Good. And then for the next 2 minutes, you're going to lift your heels again. So everything stays the same. You're still pushing the shoulders up to the ceiling. I can feel something down my left arm here, the bicep, the tricep. If you're feeling this, it's very normal. Just keep shrugging the shoulders up to the ears. This time you're pulling the strap, but lifting the heels. Just breathe. So there might be sort of lots going on in the body now. The heels are encouraging the thighs to release, pelvis to sort of position. And the arms with the hands on the blocks are also just doing what we did before. So there's sort of a doubling up kind of effect here with this exercise. Still trying to find a name for it. But it's one of my favorite ways to really just put back this, sort of reverse the sway back and an imposition in our rib cage, which can cause so much trouble for hips, pelvis, knees, feet, as well as shoulders. Keep pulling the strap. I can also feel this releasing my piriformis on the right side, which has been niggling ever since I got pregnant. So I'm just trying to be really mindful of that. Good, last 30 seconds. Just keep breathing. Good. And release. Good. Just going to release your strap. And you're just going to put the blocks away. You're going to now just come up against the wall into a flexion abdominal position. So you're going to come lay down on your back. You're going to need your cushion and your foam pad for this one. You need your bum quite close towards the wall, but your sacrum to the floor. So for some of you, especially those in a very severe sway back, you're going to need to be a little bit further away from the wall. And also for those with a severe anterior tilt, you need to be slightly further away, just so that you can feel like your sacrum is really grounded without pushing into the tailbone. And then your ankles are in line with the knees, and you're gently placing a cushion between your knees. But again, if I walk past you, I should, with my just 2 fingers, be able to pick the cushion from out between the knees. You're not going to need to squeeze that at all. The thing that I want you to have focus on is the position of your feet and the compression of the feet to the wall with that 3-point contact. So big toes, pinky toes, and heels. Then I want you to just interlace the hands here behind your head. So we're going to go for an interlaced position with the arms. Elbows are wide, chin is down towards the throat, so try not to let the chin stay up towards the ceiling, bring it down. You'll feel an opening across the chest. We're going to be here for 6 minutes. I want you to breathe in through the nose and exhale. Just breathe, inhaling through the nose and exhaling. Yeah, my body's already reacting. So just, again, I've always maintained in my videos, if you are having a big reaction, and I might say that we're staying here in this exercise for 6 minutes, you by all means can pause the video and you may stay in it for longer. You will instantly know what feels good for your body just by virtue of being in the exercise. If you're not getting big reactions, obviously just observe the recommended time or duration or repetitions and then move on to the next exercise. But if you're having big reactions, and I mean, I always have big reactions no matter what exercise I do. So, I mean, I could stay in this exercise for a little bit longer if I wanted to. The intention is to make this routine like your very own. So wherever you're at, whatever your body's responding to, by all means, make it your own. Long, big breath in through the nose. Big breath out. Again, really trying to relax into those pec areas, the pec muscles across the chest, the deep armpit areas, and just breathing in through the back of the rib cage. Exhaling. Big breath in. Big breath out. Good. Big breath in. And big breath out. Long big breath in. Big breath out. Just keep going. We've got 2 minutes on the clock. Keep connecting with your feet. My left foot tends to sort of roll outwards, so the big toe doesn't feel the wall enough. So I've just got to keep my mind on those big toes and the balls of the feet. Relaxing the cushion, just let the legs do whatever they need to do. Big breath in. Big breath out. Big breath in. Big breath out. Good. What I want you to do from here is I'm going to ask you to keep the right leg where it is, and you're only going to extend your left leg along the wall. And as you do this, you're going to try and point that left foot to try and touch it to the wall. So imagine you're pressing down on a pedal. I want you to feel like you can extend the left knee, try not to bend it, fully extend the left knee, and really encourage plantar flexion of the foot, which is a toe point. And I want the hands staying interlaced behind your head, belly's nice and relaxed. You're not trying to drop the ribs forwards, keep the ribs down on the ground, and I want you to hold this position. We're going to hold it for 30 seconds, and then we're going to do 10 point and flex with the feet to the wall in this position. Really focusing on trying to get as much extension in the knee as you do with the sort of arch of the foot. Just keep breathing. Don't lose connection of the right foot to the wall either, and whatever the legs are trying to do, just let them. I don't know whether it's just solo parenting for the last month, but wow, my body's feeling everything everywhere. I've got this massive sensation in my right armpit area. I've got massive sensations in both my legs, my left ankle, left lower leg. Yeah, all sort of good stuff is happening here. So just keep breathing. Good. Now we're going to flex this left foot. Splay the toes, feel like you're pushing the heel up, pulling the toes towards you, point the toes, flex, point. Keep that knee completely locked out. This is 3. Good, 4, 5, 6, 7, nice, 8, 9, and 10. And this time you're going to flex the left foot. So really pull the toes towards you, push that left ankle up towards the ceiling, extend that knee, feel like you're pressing it gently in towards the wall. Keep the right foot grounded into the wall and just hold. Just keep breathing. Long, big breath in. Last 5 seconds. 5, 4, 3, 2, and 1. Bring the left foot back into position. You're going to do the other side. So right leg's going to extend. I have a feeling my right leg's going to react massively to this one, just because my right knee's been giving me a bit of trouble the last couple of weeks. So. And you can see here, the amount of flexion I have in my right ankle is so much less than my left. It's crazy. And it's so crazy because my right leg is usually the one that's overused. So don't be surprised if each side is different, and don't be surprised if you're trying to do different things both sides. So I felt like I'm trying to rotate my pelvis to the left just to get my ankle to pronate on the to flex on this right side. Keep both sides of the sacrum down. Extend that leg from the arch of the foot, and then use the knee and the ankle to really try and get your right ankle to point into the wall here, and just hold. Long, big breath in. As most of you know, if you've been with me long enough, my ethos is no matter where the pain is, always start from the ground up. So there's always going to be an element of footwork, lower leg work in my routines. Always. Long, big breath in. Long, big breath out. Keep pointing. Keep trying to feel any kind of release and compensation. So my right leg's really sort of shaking out here. Just goes to show that I'm holding something really sort of in the IT band area, lower leg area. Again, if you need to pause, by all means do so, but we're going to continue with a right foot flex. Oh, I feel that so much more in my right leg. And point. And flex. Really feel like you're pushing the heel up towards the ceiling and pulling the toes towards you. Good. Point. And 3, 4, and 5. I feel this all the way in the center of my butt cheek. 6, and in that IT band area. 7, good. 8, 9, good. 10, and we're going to flex and hold. Pull the toes towards you, push the heel up, keep the sacrum neutral, and breathe. Yeah, my right leg's having a big reaction. Just keep breathing. Good. Last 3, 2, and 1. Release. Good. You're just going to push the palms slightly away. Going to bring your legs 90 degrees to the wall. Okay, so if you're already further away, you might not need to move that much. Good. And then what I want you to do from here is just cross the right thigh over the left. Okay, so you should feel a considerable stretch in that sort of right thigh, right IT band area. And this time I'm going to get you to pronate the hands into the floor. So bring the palms facing the floor, push the palms into the floor, and push the hands away at the same time. So you're pushing down with the palms and pushing out at the same time, and your elbow creases are going to turn upwards. Keep the roots of the index fingers and thumb down into the floor. And then what you're going to do from here is you're going to rotate the left knee out to extend that sort of right leg over towards the left side. You're going to see that your left foot points over to the left edge of the foot into the wall. And I want you to hold this about 3/4 of the way. Gentle press of the left edge of the foot into the wall and look over to the right. Elbow creases are turned upwards. I want you to breathe. Long, big breath in. Long, big breath out. Good, big breath in. And big breath out. Long, big breath in. Big breath out. Breathe in through the right side of the rib cage. And then what I want you to do from here is reach this right leg over towards the ceiling on the left side. You can see here I've picked up this right leg off the left thigh. My left sort of outer thigh is going to be on the ground, and I'm reaching this right leg and across over towards the left. I want you to keep the head looking to the right. I want you to breathe here. I want you to just soften the knee, but point the foot. So there is going to be a good shake, I think, of your right leg with the knee soft. So just keep it soft and just hold. It's a good encouragement of trunk rotation here as well.
but really just releasing any compensation in the outer area of the lower leg, upper leg. Breathe. Amazing. And release. Keep the hands pressing down and away. You're going to cross the whole of the left thigh in front of your right. It's a bit of a tongue twister. Keep both sides and the back of the sacrum down on the ground on both sides. Press the hands away. Again, elbow creases are trying to turn upwards. And feel the root of the thumb and the index finger down. Trust me when I say that has everything to do with compensations and things that we've basically done our whole lives with our hands in this position. It encourages the shoulders to round forwards, but then to compensate, we have to pull the ribs in extension. So this is really reminding the shoulders of where they need to be and how they need to correlate with the forearms and the hands. And then we're going to roll the right thigh over towards the side. Keep the right edge of the foot into the wall, sole of the foot's pointing over to the left, and just turn your head to the left and breathe. Just release. Feel like you're actually trying to pull the left hip down towards the ground. You're going to feel like a little bit more oomph there in that left outer thigh. Try not to let the head catch or the neck. Just breathe. See my left ankle's having a nice reaction here. Good, and then here we go. Keep the knees soft, but feel like someone's pulling that left ankle away and just breathe. Almost like you're kicking a football. Just breathe. And release. Amazing. And then what I want you to do is take the feet wider than hip distance, still onto the wall, and you're going to turn the knees inwards, feet outwards, and you're going to hold this position. So I just want you to keep pressing the palms into the floor, elbows upwards, just keep breathing, just encouraging really nice internal rotation here of the hips. And then for the last 1 minute, just flip the palms up, relax the fingers. Whatever happens in those arms or the upper body, just let it happen. Just keep breathing for me. Just keep breathing. Just keep breathing. Good. Both my feet are facing the right and the left side of my room. My arms are relaxed. Amazing. And release. Good. And just roll over. You're going to roll over. And I want you to come onto hands and knees just for a moment. Now, if you are pregnant, if there's any reason why you cannot squeeze a cushion in your belly like so between the thighs and your ribs, it could be a recent scar, it could be a recent surgery, it could be pregnancy, it could be any of those things. Please do not put a cushion, obviously, in this position. What you can do is take the knees wide and just take a normal sort of traditional yogic child's pose. If you can get a little bit active in the child's pose, I would recommend having the knees together, feet together, and you trying to sort of clip the heels together, okay? So you got to take that modification the best way you can for where your body is at. For a normal sort of setup, you're going to take a cushion right across the in a horizontal plane. You're going to basically bring your belly and wrap it over the cushion and squeeze it between your thighs. Hands are going to start just by your feet as you release the neck here and just lay the shoulders down to the floor. If your head gets to the floor, great. If it doesn't and it's too much strain on the neck, by all means put a block under your neck. Sorry, beg your pardon, under your forehead. Otherwise, use it as a really nice way to release your neck and just bring your head down. We're going to hold this position. Remember, heels actively coming in towards each other. So this is a little bit of footwork as well. We're just going to hold this for 45 seconds. I want you to breathe. Just going to take the mic away just in case it gets a bit muffled. And just keep breathing here. I can feel something already releasing in my left shoulder, right shoulder. So whatever's happening for you, just let it. Hands are completely relaxed. Your elbows are bent, elbows are supported on the floor. Just breathe. It's 10 seconds on the clock. Good job. And now what you're going to do is you are simply going to take the same position, but you're going to take it onto, you're going to extend your arms on 2 blocks. So you're going to place both palms on blocks. So you're going to do child's pose with hands on blocks. You're going to really release the elbows inwards. So watch this a little bit in terms of setup. Normally your elbows will want to stay wide and out. I want you to feel like they are just relaxing down to the ground, but without your hands cupping or the hands staying loose. So keep the palms down on top of the blocks, fingers wide. Your elbows are down and your head is just releasing. Now, many of you, including myself, my head will not get to the ground here because obviously the cushion is going to be elevating the rib cage, and that's fine. But this is amazing for the back of the neck. So be mindful. If you've got any kind of like neck injury, I would recommend just putting a towel. It could even just be a foam pad under the sort of forehead, because you can still get the release, but it won't be as much traction, just to keep it safe. And I would recommend doing so if you've had a recent sort of spinal injury of any kind, so that you're not sort of traumatizing the areas of the cervical spine. But otherwise, if you've just got a stiff neck like me, this is going to feel great. So just breathe. Elbows are soft. We're going to hold this for just over a minute, keeping the bum trying to come to the heel. So that's the most important thing. So for me, I'm having to bring the blocks a bit closer so I can not feel like I'm tipping forwards. Breathe here. Just breathe. And notice with every exhalation how much rounder you can get, how much more your head can get to the floor as you relax. It's such a nice way just to sort of uncover so many onion layers through relaxing deeper and deeper. Just breathe. So good. And then you're going to release. If you feel lightheaded, please just take a minute. Just place your cushion over to the side. And for the last little drill, you're going to bring the blocks underneath your shoulder, underneath both your shoulders, hands on top of the blocks. Spread the fingers wide, elbow creases turning forwards, and your shoulders are meant to be directly over the wrists, okay? So this part is really, really important because many of us tend to tip the body weight forwards. The more you try and align the shoulders over the wrist, the less pressure you'll feel in those wrists, okay? And then you're going to unfold the feet, so tops of the feet into the floor. You're not going to have your knees too close to the back of the wrists. You want them a good distance away. And then what you're going to do from here is you're going to curl the tailbone up, press the shoulders towards the ceiling and round the spine here and drop your head. Press the hands as hard as you can and really feel like there's capacity now for you to flex into that spine. Long, big breath. Use the feet actively into the floor. Keep pressing them into the floor. Big breath here. Good. And then what I want you to do is you're going to press the left knee to the back of the left forearm, and you're just going to keep flexing and hold. So a bit of activation here in the core. Good. Left knee down, right knee to the back of the forearm. Just keep breathing. Don't compromise on how much you round into the shoulders. So what will tend to happen is you'll lose that sort of rounding in the spine. It will also reduce the amount of extension you have in the hip. I want you to feel like you're pushing between those shoulder blades. Amazing. And then you're just going to come into a seated position. This part will feel quite nice. So you're going to keep both the blocks flat on the ground, and you're going to turn them slightly inwards towards you, like maybe 10 degrees. And you're just going to bring your calves just on top of the blocks in a sort of slightly wider than hip distance position with both your legs. If you can sit here with your spine completely relaxed on this level, then do so. But if you'd like to go a little bit sort of deeper into height, because this will also affect how the legs release, then do so. But I don't want this to be at the compromise of you then leaning back, okay? So take whichever modification works best for you. And then for the last 2 minutes of this entire posture routine, you are simply going to fold forwards. I want the hands just on the floor here, not over the legs. And you're just going to bring your head between your knees. Take the legs as wide as you can, especially for my pregnant friends. You are going to just take the blocks wider so that you can just basically give the belly capacity to fold forwards like this. And we're just going to release here. Yeah, there goes my right leg. My legs are releasing. I want the bed of the calves, or just below the bed of the calves. So the lower calves and the calves just on top of your blocks, okay? Essentially what this will do is encourage a big release in the lower legs and then help you release into the hips and the pelvis, which then encourages a nice release in your spine, your rib cage, and your shoulders. So just keep breathing here. This is the last minute on the clock. And I can feel something in the left side of my neck all the way down into my shoulder blade, really releasing. Amazing. As said, you can stay in any position as long as you need. You just pause the video, and for the last 30 seconds, I just want you to lay on the ground. Arms can be wide, knees bent. Just give the body a couple of seconds just to reset. Good. And then you're just going to roll over and come up into standing. I just had a nice click there on my knee. Okay, I'm finishing with your balance test. Feet hip distance, shake them off. Try not to bias the feet when you land them. Try not to make them feel or look a certain way. And just come into a nice easy standing position. Yeah, I can feel a massive difference in my left leg. Right shoulder also. And my head feels like it's kind of sitting right above my sit bones. Head is very firmly on the swivel. Overall feeling really, really good. And I hope in your balance test, this has also had a positive outcome. If it has, essentially what you've just figured out is that you have quite a considerable dysfunction in rib cage, pelvis, hips, and feet. And by basically using this routine to put function back into those areas, you are improving your balance, your posture, your movement, your muscle function, your nervous system.